Hi, I'm Christine, and I will be discussing what is situational awareness, its history and relevance to healthcare and nursing. Have you ever experienced being in a situation where details are important? I will be presenting a video where we will test your observation skills. Make sure you watch it carefully.
The monkey business illusion. Count how many times the players wearing white passed the ball. The correct answer is 16 passes. Did you spot the gorilla? For people who haven't seen or heard about a video like this before, about half missed the gorilla. If you knew about the gorilla, you probably saw it. But did you notice the curtain changing color or the player on the black team leaving the game? Let's rewind and watch it again. When you're looking for a gorilla, you often miss other unexpected events. And that's the monkey business illusion. Learn more about this illusion and the original gorilla experiment at theinvisiblegorilla.com.
As you were watching the video, did you notice the gorilla, the changing color of the curtains, and the person leaving? If you noticed all of this, good job. However, it is common fact that not all of us will be able to notice all of this, particularly when we are focused on one. This is the focus of our topic today, situational awareness. Being nurses, we need to always be aware in our surroundings, particularly when we are taking care of our patients. But let us check first on its history. History and relevance to healthcare and nursing. According to Gilson, the concept of situational awareness was identified during World War I by Oswald Volk, who realized the importance of gaining an awareness of the enemy before the enemy gained a similar awareness, and devised methods for accomplishing this. Situational awareness to healthcare and nursing is a fundamental and well understood concept used to maintain operational safety in high reliability organizations. However, it has not been studied in nursing. Nurses play a critical role in providing vigilance in healthcare, and what they do or fail to do is directly related to patient outcomes. Three defining attributes of situational awareness include perception, comprehension, and projection. Situational awareness is identified as the perception of the elements in the environment in a volume of time and space, and comprehension of their meaning and the projection of their status in the near future. Although situational awareness is related to other terms in nursing, there is increasing recognition that the concept, which is likely a consolidation of the related terms, has an impact on healthcare professionals. Three levels of situational awareness. Level 1 is perceiving critical factors in the environment. SA begins with perception of your mental picture of reality. You perceive the information through your five senses, such as examining a patient, reading medical chart, interpreting test results, or listening to input from other team members. The perceived information must be timely and useful so that you can take action on it as needed. In other words, you must gather all relevant data that's needed at the time. As you get more sensitive, your perception of the environment more closely resembles reality. However, your perception is affected by three factors: past experiences, expectations, and filters. Level 2 is understanding what the critical factors mean, particularly when integrated with the decision maker's goal. You must also be able to properly process the information. The next level of SA involves understanding, analyzing, classifying, and integrating the information you perceive, and serves as the basis of your subsequent decision making and performance. At this level, you grasp the meaning and importance of your perception as the basis of what actions to take. You are also able to determine how much time might be required to take and complete the action. Level 3 is understanding what may happen within the situation in the near future. The highest level of SA is the ability to project events that might happen based on your analysis of the information and results of your action. As in level 2, you can estimate the amount of time it might take to resolve these potential events. However, a pitfall of projecting into the future based on what has occurred in the past is applying an established procedure without first questioning whether it is appropriate for the patient's situation. Other industries that use situational awareness. In the military, during combat, situational awareness is the ability to see what's in the vicinity and anticipate what's not. Knowledge that can mean the difference between survival. Situational awareness is also the integrated web of networks, servers, storage devices, and analysis and management software that ingests data, makes it available for analysis, and then share it anytime and anywhere, up and down the chain of command. In aviation, for a pilot, situational awareness means having a mental picture of the existing interrelationship of location, flight conditions, configuration, and energy state of your aircraft, as well as any other factors that could be about to affect its safety, such as proximate terrain, obstructions, airspace reservations, weather systems. The potential consequences of situational awareness include loss of control, airspace infringement, loss of separation, or an encounter with wake vortex turbulence, severe air turbulence, heavy icing, or unexpected strong headwinds. For a flight controller, situational awareness means acquiring and maintaining mental picture of the traffic situation being managed and maintaining an appreciation of the potential and unexpected progressions or changes in this scenario.
Hi, my name is Naomi, and I'm going to be talking about the purpose of situational awareness and the frameworks of situational awareness. As mentioned earlier, the most predominant framework associated with situational awareness is Endlessly's situational awareness model. Within this model, situational awareness is comprised of 3 levels. The first level is perception. This is the first step to attaining situational awareness. This is the ability to perceive role, information, status, and attributes and factors of the environment. The second level of situational awareness is comprehension and understanding the significance of the present factors perceived in level 1. This is grounded in the knowledge and understanding of these factors present in the environment. Following this, the individual should be able to project the future status of the situation based on the information they've gathered in level 1 and level 2 of situational awareness. Level 3 highlights the dynamic factors that play during situational awareness. As an aid to assist employees with situational awareness, the Health and Safety Executive of the United Kingdom devised SLAM, a 4-step process to situational awareness. This encompasses stop, look, assess, and manage. Stop. Consider your actions before engaging with the task. Look. Observe the workplace for any potential harm. Assess. Analyze these hazards and the potential effect they may have. Manage. If the process is not safe, stop working. This is an aid to encompass the 3 levels of situational awareness Endlessly has discovered. The role of both of these models in situational awareness is to address the present factors of situational awareness. Situational awareness is almost always affected by perception of the individual experiencing the situational awareness. If the perception of the individual has changed or is different from other individuals, both of their processes will equal different situational awareness outcomes. This can be influenced by a number of factors. 2 factors that influence this perception are individual factors and system factors present on the right-hand side of the screen, as shown. The purpose and importance of situational awareness lies in decision-making and leadership. Within decision-making, situational awareness allows healthcare professionals to be able to be aware of the number of problems they are facing in a critical condition. This allows, during that high-stress environment, for individuals to be able to prioritize appropriate tasks to be able to put patient care and patient safety first. During decision making, the individual then is provided with an evidence-based rationale and thought process to be able to make sure that they are able to prioritize patient safety throughout the process and be aware of the choices that they are making within the situation around them. The second purpose of situational awareness is leadership. As a branch of decision making, although all members of the party have a sense of situational awareness, the leader is the person who makes the final decision. Within leadership, leaders have to examine and contain all possibilities of the immediate environment and their perception. Leaders are responsible for committing and discovering any new situations, and they are able to make their decision based on this information found in the environment. HSC also developed 4 moments of situational awareness so that everyone is aware of the moment situational awareness must occur. The first is when introduced to a new environment. The second is if the environment changes. The third is when working with different team members. And the fourth one, before complacency has set in.
So I'm going to be talking about patient safety and patient safety principles, as well as the role of the nurse in relation to situational awareness. So much of healthcare education places a great focus on having clinical skills and evidence-based practice, which we all know is necessary for healthcare providers to become proficient and competent in their everyday practice. But despite this, patients still experience adverse events which impact their safety and overall experience of their healthcare. So this is why situational awareness is so important in regard to patient safety. Growing evidence suggests that there is a need for healthcare providers to improve and expand on their non-technical skills. So situational awareness is one of the many critical non-technical skills, in addition with other skills such as communication, decision-making, and teamwork, etc., that are used by practitioners in healthcare. So within the clinical setting, situational awareness allows healthcare professionals to process and manage their environment, as well as understand what is occurring around them. So now I'm going to be looking at patient safety principles. So patient safety principles act to ensure that a healthcare professional's care to their patient is executed in a safe and accurate manner with minimal risks. The Australian Safety and Quality Framework for Healthcare 2010 covers 3 main principles to providing this safe, high-quality healthcare. These are 1. Consumer-centred, 2. Driven by information, and 3. Organised for safety. In relation to situational awareness, we will be focusing on Principle 3, in particular Principle 3.2, which is health professionals taking action for safety, and Principle 3.8, which is taking action to prevent or minimise harm from healthcare errors. So situational awareness allows us to ensure patient safety as it helps us recognise anything that is out of the ordinary, which can help us pick up things such as deteriorations in our patients. So in turn, this can help us achieve Standard 3.8. Moreover, being aware of one's surroundings contributes to decreasing errors associated with unfavourable events and poor patient outcomes. So on this slide, I just have a few arrows pointing at what situational awareness is really about and what it focuses on. So it focuses on detecting potential errors, minimising adverse events, and ensuring patient safety. So situational awareness is used in our day-to-day lives without us even noticing sometimes. So for example, it might be noticing what someone is wearing or remembering where the nearest emergency exit sign is, to being in the kitchen, multitasking, keeping your eye on the stove, keeping an eye on other things. Also in driving, keeping your eyes on the cars and the road in front of you and beside you. This is essential because it helps us identify hazards or dangers that occur around us. In the clinical setting, situational awareness becomes crucial as it helps us detect any cues or errors and determine when an adverse event may occur. So for example, It may be as simple as the nurse seeing a patient with symptoms of a fever, a cough, increased heart rate, decreased blood pressure, and immediately they might think ahead of what could be happening. Sepsis or hypovolemia, they would immediately redo the vital signs, inform the doctor, things like that. So situational awareness is very quick, but it's extremely useful as it conclusively helps minimize the risk for error and detect error. Other examples could be things such as the nurse coming onto handover, sees the patient has IV therapy running, and immediately the nurse will think why they're on IV therapy, linking it back to the handover sheet, the patient's situation, etc., things like that. So, overall, situational awareness in nursing is really closely related to critical thinking. The two sort of go in hand together, which is really important and necessary as a nurse. So, the author White reports the importance for nurses to build their understanding of non technical skills in order to minimize adverse events and improve patient safety. Being an established concept, the relationship between situational awareness and nurses is imperative to deliver optimal patient outcomes. Nurses account for the largest profession in healthcare, and without them, attaining vigilance would not be possible. Having the most direct contact with patients, nurses constantly carry out assessments, planning, ongoing monitoring, and evaluation of all their patients. In the near future, we will all be practicing as registered nurses working alongside patients every single day. So it is critical that we understand situational awareness, how it works, and how it can impact us and our patients directly or indirectly. What we do or fail to do is directly related to patient outcomes. Because of this, nurses are typically the first to detect and intercept errors and are in the best position to initiate immediate actions that will decrease undesirable patient outcomes. Situational awareness assists us in placing focus on what is important. This is crucial in healthcare and as nurses because we care for so many patients simultaneously.
Thank you, Christine. I will now talk about relevant websites and information and how situational awareness relates to clinical practice. The Clinical Human Factor Group is a charity working in partnership with health professionals, management, and service users campaigning for change in healthcare within the UK. This organisation was founded by Martin Brumilli, who in 2005 lost his wife as a result of medical errors during a routine operation. It was founded that the health professionals failed to maintain situational awareness. In hindsight, a range of human factors were contributing to his wife's death. I think this is a great organisation in which highlights human factors, not only from healthcare industries, but from other industries such as aviation, to encourage safe practice no matter the industry. This website influences national policies by raising awareness. This organisation also provides seminars, programs and resources aiding training and policy making in healthcare. If there is one thing you can get out of this organisation and hearing Martin's story, it encourages leadership, teamwork, communication, and lastly, to not be afraid to speak up. Another informative website I found was Canadian Medical Protective Association. It is incorporated with Acts of Parliament, working with health professionals to empower a better healthcare system in Canada. Building situational awareness, CMPA relates its acronym PET to a building block of human factors. It explains 4 key elements for acquiring situational awareness. This includes the patient, the environment, the task, and time. I will break these down further. The patient. This is a very important element in understanding your patient, knowing their history, discussing with other health professionals and family members to have a complete overview of your patient. The environment. Often in healthcare, we cannot change the environment in which we work in, but we can change elements that can enhance our workspace, such as having appropriate resources, lighting, reducing noise and distraction. The environment can also include having enough staffing to optimize staff workload. Task. It is vital to be aware of the task you are completing and to know in healthcare plans and patient conditions are always changing. The last acronym is time. Studies suggest, depending on the time of day, performance of your workload can be affected. For example, working a night shift can have suboptimal performances. Therefore, good team communication and being aware of the time are vital in critical situations. Also, planning ahead of time is desirable for situational awareness. How situational awareness relates to clinical practice. In 2016, data from the Australian Institute of Health and Welfare estimated there were around 27,000 potentially avoidable deaths throughout the Australian healthcare system. Furthermore, between 2015 and 2016, 230,000 patients experienced unwanted side effects, which included infections, falls, medication errors, and surgical device errors, ultimately costing the economy an estimated $1.2 billion annually. In the next coming slides, I will discuss some strategies as to how we can improve our situational awareness and to be the drive to reduce the number of incidences occurring in the healthcare system. Before I dive into a strategy to aid situational awareness, we would like you to watch this short clip in the next slide.
Yes, absolutely, yes. Thank you. Hi, Helen. Settling in okay? How are my post-ops doing? That's fine. Let's go on a ward round. Are there any nurses available?
I think there's another round going on, but I'll get someone.
No, it's fine. Never available when we need them anyway. Let's just start this round. We can't be waiting. Hello, Mrs. Jones. How are you feeling?
Oh, not too bad. A bit groggy, but pain's okay.
Okay, that's fine. Your operation went well. No issues there. We'll have you up and about by tomorrow, hopefully. Can I just have a press of your tummy? Right, Helen. Abdomen soft, wound dry. Catheter out tomorrow. Free fluids tonight. Normal diet tomorrow. And outpatients in 6 weeks. Has she had her antibiotics?
Oh, no, what would you like? Kef and Met?
Oh no, that'll give her C. diff. A spot of comoxiclav. You're doing very well, Mrs. Jones. I'll catch up with you again tomorrow.
Okay, thank you.
Come on. Hi, Mrs. Stevens. How are you doing?
Hello, Mrs. Jones.
Ow. Nurse? Nurse? Could you help me, please? No, now.
Yes,
It
just
it
one
really
moment.
hurts now. I really need to go to the loo and I just don't want to have an accident.
Sorry about that, Mrs. Jones. How are you feeling?
I'm okay. A few twinges, but I'm all right.
Well, the doctor's written you up for some painkillers, so I'll give you those to make you feel more comfortable. And some antibiotics as well, okay?
Sharon, I need to talk to you. I'm worried about Mr. Wilson. His Muse score's 6.
Sorry about that, Mrs. Jones. Where were we?
Medicine?
Oh, yes, that's right. You've got a red wristband on. What's it you're allergic to?
Penicillin. I get like a really bad rash when I take them tablets.
Right, Mrs. Jones, these are your antibiotics, okay?
Which ones are they?
These called augmentin.
So yes, this scenario was fairly exaggerated, but we would like to start a discussion on what we could have done differently in this scenario. Let us know in the Blackboard discussion. One thing we noted that was poor in this scenario was their handover. Many studies have identified poor shift handovers are a contributing factor to incidences. In healthcare, teamwork and effective communication is integral to providing safe, effective patient care. As most of you are aware, isobar is a universally used clinical handover tool effective in identifying yourself and your patient, explaining the situation, observations and clinical assessments, background information including medical history and other relevant information, agreed plans, and lastly, reading back for clarification for shared knowledge. Use of isobar is a well-recognized tool effective in identifying patient outcomes. Clinical handover is one of many tools used in hospitals to increase patient safety and reduce the risk of any miscommunication and enhance your situational awareness. So that concludes our presentation. We hope you've found it informative and have gained some insight into the importance of situational awareness and you're able to implement it into future practice as a registered nurse. Thank you.